Buenos días a todos. Me parece que ya tenemos suficiente quórum para retomar nuestra 19ª sesión del Subcomité de Programa, Presupuesto y Administración. Bienvenidos a todos y encantados de retomar los trabajos el día de hoy. Iniciaremos, como se comentó el día de ayer, con el punto 3.1, anteproyecto del Plan Estratégico de la Organización Panamericana de la Salud 2026-2031. Señalo a la atención del subcomité el documento SPBA 19.2 e invito al ingeniero Ronnie Massa, director del Departamento de Planificación, Presupuesto y Evaluación de la Oficina Sanitaria Panamericana, a que se acerque a la mesa principal y presente el punto.
Good morning. Thank you, Madam President, Director, at table, distinguished delegates. It is indeed a pleasure to present an overview of the proposed new strategic plan of the organization and give you some highlights as the document continues to be built, just as of, which is a product, by the way, the progress you're about to see. And this document is the product of great collaboration, a great engagement, but also that a relationship that we enjoy with our member states as PAHO, the organization, with your secretariat facilitating, serving you to ensure that the document responds to the times and needs, to the current times and needs. And thus, this document that we were just working on the last week because of that consultative process, engagement process that we have with you. Up to last week, we had the 4th consultation, and therefore, you saw the complete document published last week around Thursday or Friday. And therefore, this document, just to caution as well, that is a work in progress. It is also has benefit from input, not just from member states, but also from stakeholders. So we're building on the lessons, the experiences that we have with our strategic planning, but also that solid results approach that our member states and our peoples deserve to continue improving, innovating for greater impact in our countries. With that, let me share some slides, some highlights of what is in the extensive document before you. So as a way of the overview and why this document? Well, it is a requirement, set the requirement that the organization presents to member states every 6 years, a strategic plan that sets the medium-term strategic direction of the organization. So we're looking here towards 2025 to 2031. And therefore, while looking at the situation, also the opportunities in building forward. It defines the collective, and this is important, that it defines the collective priorities and results of the organization, that of member states across the region. And of course, with the Secretariat looking at the evidence that we have to ensure that those priorities and results are also realistic, but in line with what we're seeing in the landscape, both in public health, but also those external factors that impact on public health. It looks to build, and that's something that our member states have highlighted from the lessons we have documented and on how we demonstrate, again, the organization's unique value added. How do we drive impact in countries? How do we measure that and demonstrate that indeed there is greater impact at the end of 2031, that we have moved the needle towards improving health and well-being across the region and in each country of the region and territory in the region? How do we address the gaps? How do we address the inequities that continue to persist across the region, across the countries, but also within the countries? But it also responds, and this is important, that we remain country-focused to country priorities, first and foremost. But how those country priorities and those commitments also respond to the commitments you have made at the regional, at and global level towards 2031. You will see that this goes beyond the 2030 SDGs because we need to go beyond that as we plan here in the region. And how do we remain true to respond to the health situation that we're seeing? But building on lessons learned that we have documented but also want to remain true to is the external evaluations. This organization, under the leadership of Dr. Jarvas, has strengthened the evaluation function, external evaluation function, and how do we look at that evidence? How do we look to that external view and recommendations, and that allows to improve how we work here at PAHO, how we deliver with your member states and the partners. The external audits as well have been considered, and also our internal reviews, because we do have a practice here, and just 2 weeks ago, our director held the 6-monthly performance review on how we implement operational plans. We have also been looking at that to inform the plan. The plan needs to respond to the situation. As we do in any plan that we develop, we first look at the diagnosis. First, the context. And this context, of course, goes beyond health. The political, geopolitical landscape, the health situation, and other external factors that impact on health, as we know the determinants. We have, and we must celebrate, the great strides in improving health and well-being in the region. The Americas continues to be a pioneering region that shows the world on how public health advances could be made through elimination of diseases, but also reducing mortality and morbidity. The toll of the pandemic has been analyzed carefully, and as you know, and we have documented this extensively, the region was affected more than other parts of the world. We have looked at the health-related targets, how much progress we have made. There's a lot of progress, but also challenges, both in the region and globally. The determinant, and when determinant is social, but the commercial determinants, the risk factors, the barriers that prevent achieving or reaching those that is not easy to reach to, and those persistent gaps that we need to address. And also the vulnerability. And when we speak of vulnerability, environmental, but also social, and all aspects that impact on the health of the people, be it by natural phenomena or catastrophic events that are impacting the people's health. When we look at the mega trends, we have also, in the document, you will see an extensive situation analysis that look at the demographic shifts, for example, the aging of the population in the region, the political changes in the region. How do we manage that? That is a constant. We see as democracy, as our director always reminds us, how do we continue to work with our member states to ensure that the people's health needs, the well-being are at the center and a priority of what we respond according to our mandate. The economic forces that also affect health, the commercial determinants in particular, technological advances and risks. But while we look at the risks, also the opportunities of harnessing the power of innovation. The social and cultural shifts, that's important as we look at health, intricately related. And of course, the environmental changes. And the impact on health and well-being, we see, and we analyze in that chapter that you will see, ongoing challenges on how we orient health systems that are more integrated and address indeed the first care level through a primary healthcare approach. The access barriers that exacerbate inequities, and how do they prevent us from moving forward in effectively tackling communicable, non-communicable diseases, mental health that continues to see a challenge, and the health through the life course. So a comprehensive and integrated approach to respond and address the needs of the peoples. The multiple health system challenges and how they prevent progressing towards universal health. And again, looking at closing gaps. And how can we be more effective in reaching and accessing health technologies, health medicines, advances in science that can really benefit the people's health and well-being. Apologies. At the end of this strategic plan, and in line with its aim, we seek to leverage PAHO's unique position to ensure that the peoples and communities in the region enjoy optimal health and well-being, and to make your secretariat, the PSB, the Bureau, fit for purpose to work with you to work with our partners to accelerate progress towards a healthy Americas and equity and resilience. And you will see across this document and in the discussion and that process with the member states and our technical teams is on how do we accelerate, especially as we recover and build forward. As we move to the timeline, just to highlight here that this is the roadmap that our member states approved in the executive committee last year. So 9 months later, we celebrate the great progress we have made in achieving those milestones. As you will see from the timeline, we have reached milestone 2, and we're moving forward to develop the first full draft for the executive committee, and therefore the opportune timing here to present to you the progress, but also get your guidance, your insight on how we continue to build this document with the input, of course, of our member states. As you will see in the roadmap ahead, we have at least 2 more consultations with our member states. The consultative process will continue, but not just with member states, with the stakeholders. We have also received great participation from the stakeholders. This is something that we added in this cycle of the strategic plan. And using technology, it has allowed us to reach and get more input from across the region, from stakeholders and our member states. Important to note here as well is that as we develop the strategic plan, we need to develop the first program budget, and I will speak on that on the subsequent item. The goal here is to reach September with a solid document that responds to the needs of the countries and the region, member states. Just to highlight some of the progress that we have made since you approved since you saw the update, in September at the Directing Council, and remaining true to the commitment we made to you to continue improving, innovating for greater impact. We have advanced on the development of the theory of change. These are pathways to show on how we reach those goals, those results that are outlined in the strategic plan at the level of the outcomes and an overall theory of change that will be developed for the strategic plan. The country strategic input, this is in getting the input from our member states in building from a bottom up, from a true member states input. Consultations, so in addition to the collective consultations we had as members in the sessions that we've been holding almost every month, we have had our country offices under the leadership of our PAHO representatives, what we call the country strategic input. This is an innovation that we put in to gather input from our member states directly, one-on-one, on where do they see that PAHO's technical cooperation should be directed, and what is that opportunity to build on that. And that has been used as an input that inform the development of the strategic plan, the outcomes and the scope that is before you. We have also created, given that addressing equity in the region continues to be a priority, created a health equity working group to look at all the dimensions of equity and how they can be incorporated into the plan. We have had 2 sessions. I believe there are 8 member states in that, and we thank them for their collaboration and their input. And we will have 1 more session with that working group to ensure that we're very clear on what we mean by equity in health and addressing the inequities, on closing gaps. We have advanced in the development of document. At this time, we are about 2/3 of the document, based on that great progress we have made with you and your input. In addition to getting the consultations every month, we really thank the member states who provide written comments, extensive written comments, for us to then look at the document and come back to you. That iterative process has been very rich indeed. We are conducting country prioritization, again, building with our countries. Some of you, I understand, have been involved already with our country offices in reviewing the priorities. This is the time to really focus on priorities. We don't have all the resources. If we want to have greater impact, we need to focus on priorities, and that rigorous approach and systematic approach we've developed in the region has proven to be very effective. And we thank again the member states who have engaged with our teams at country level to have those consultations. To date, we have 30 of the 51 countries and territories that completed this. We aim to get, according to our records in the past, to about 90% of that, which we are about 45 to 46. We would like to reach 100%, but the timeline sometimes does not allow. But if we can get to a 90%, we'll be happy. Aiming to 100, happy with 90. In terms of the member states and stakeholders consultations, and I just want to clarify here, consultation member states is a member state-led process. The input from member states is consultation. We have informative sessions with stakeholders. As the mandate comes from our member states, of course. We have developed, in trying to communicate as well, a PAHO strategic plan website where you can see and others can see the development in a transparent manner on how this document, and also make suggestions. We have also, in improving our way of communicating and refining our results approach, we have revised the PAHO results chain. Again, we have presented this in the consultation process, and we have refined the definitions to ensure that we are clear on what we mean by what the Secretariat also is accountable for versus what is joint accountability with our member states at the outcome and impact level. When it in terms of the summaries that I just wanted to share with you of what is coming from the member states consultations, is that member states and stakeholders appreciate the higher strategic orientation of the plan with the 5 strategic objectives, the more integrated approach. Our member states have also highlighted the importance of the strategic plan to build on a principle of this organization, a value, Pan-Americanism, regional solidarity and cooperation, and how to continue building on that so that we can deliver on the results proposed in the strategic plan. An integrated and results approach has been welcome, and we will continue refining as we move forward. And also the emphasis on specific topics. Our member states are coming back to us and says, okay, please elaborate and be clear on conceptual aspects, equity, well-being, determinants, and how the strategic plan will respond to that. When it comes to the outline, and this, the SPBA, we would usually present an outline to you. At this time, we're presenting content to you, not just an outline. Content because we've been able to build, again, with that rich process with our member states. As you can see from the table of contents there, we pretty much have all sections. I'll highlight that under the regional agenda, we are working on the integrated approach on equity. That's something that we're still work in progress. And in the appendices, you will see the detailed details on the results framework. We are working as we speak on outcome indicators. That's something important, ensuring that we have targets, baselines. We have had a rigorous process here in the organization that every indicator must have a baseline target. We must have data to measure. That's a lesson that we have documented and ensure it will not reoccur, because in the current strategic plan, we had several indicators that we committed to, but data was not available. So we cannot measure it with any progress. So building again on that evidence and results approach. We continue to work on the theory of change, and that's something that we aim to have in the next month, so that you can also see the pathways on how we will work together to achieve those results proposed in the strategic plan. And this is a diagram that, again, we developed to better communicate our integrated approach, but also results with that vision in the middle to improve health and well-being across the region, but also the outcomes, the results approach through the outcomes, and then the outputs that will be in the program budget. The results chain of PAHO is combined of 3 levels: impacts, outcomes, outputs. Just to note that the outcomes and the impacts are in the strategic plan, and the program budget brings the biennial outputs, which are developed in every program budget that's presented to you every 2 years for your approval. Going a bit deeper into what's in the document, and you will find a detailed section for every outcome on what's in the scope of each strategic objective. Apologies. You will see that under each strategic objective, there are outcomes, 2 or 3 of them. And under that outcome, we have the scope. For instance, Under the first strategic objective on health equity, social determinants, risk factors, climate change, and health, the emphasis there will be in reducing the health inequities, addressing the determinants and risk factors, promoting health and well-being, and adapting to and mitigating climate change impact on health. This is the impact on health that we must respond to. Under the strategic objective 2, resilient health systems and services based on primary health care, we're looking at driving transformation of the health systems based on primary health care. Again, the emphasis on primary health care that has been the focus of discussion of many fora, just at country level and regional level. Ensure that there is availability of critical resource. Human resource for health is a priority the member states continue to highlight. Financing, technologies, and information systems. Digital transformation is another priority that your member states have highlighted, and there's also an emphasis in that strategic objective with regional innovation and production also of medicines and technologies. Another important priority and one of the pillars of our director's priorities for the next 4 years. Under the strategic objective that focuses on disease prevention, control, and elimination, and please note, this also covers the NCDs and mental health, to intensify the efforts to keep moving that momentum of the elimination agenda that your member states have also approved a couple of years back, to prevent and treat communicable diseases, non-communicable diseases, and mental health conditions. The emphasis on mental health has been something that has been discussed as a high priority, and also other conditions. Improve on response to violence, traffic accidents, injuries, and AMR, antimicrobial resistance. Under health emergencies, we continue to build on the strength of the region, reinforcing capacities, address gaps to prevent, mitigate, prepare for, and ensure that we're ready, building on the lessons that we had from the COVID, but also other emergencies. Ensure rapid threat detection, assessment, and response to health emergencies and disasters. And on the fifth strategic objective, where the Secretariat looks to also with your member states, improve PAHO's leadership, governance, and performance. Performance for results, of course. Strengthen the strategic and enabling functions so that we can continue to be agile, fit for purpose, but also efficient, transparent, and accountable to your member states, and systematically improve, innovate, modernize our management practices. You saw some of those examples that our director presented yesterday of initiatives that are looking at that under the PAHO Forward initiative. When we look at measurement, important that we also build on the lessons and best practices. Here is a snapshot of where we are and in terms of the numbers of the indicators that we have at each level, and we have put there for reference what was there in what is currently in the strategic plan that we are going to conclude at the end of this year, but also the WHO General Program of Work and indicators in numbers. So as you can see, currently, the current strategic plan has 7 clusters. We don't have strategic objectives. We group the outcomes into 7 clusters. We propose to have 5 strategic objectives in the new strategic plan. At the level of outcomes, we have quite a disaggregated number of outcomes. That's something that we have integrated. And those are now 12 outcomes, higher level results-oriented outcomes. At the impact level, we have currently 28 impact indicators in the strategic plan at this time. The proposal is 18. We have reduced by 10 there, again, focusing on what needs to be measured, what is important, and linked to the aim of the strategic plan and that vision of the strategic plan. And at the outcome indicators level, you can see also a reduction from 99 indicators to 84 indicators, a 15 indicators reduction. You can see the numbers of WHO. WHO also has 5 strategic objectives, or strategic priorities, as they call them. At the outcome level, they have 18. We have 12. And at the outcome indicators level, they have 97, and we have 84. We are continuing to refine these numbers. And please rest assured, as we see room for improvement, and we welcome your feedback as you review the list of indicators also, we welcome your feedback on how we can continue to refine those measurements. In closing, just let me note here the next steps. Refining the indicators, as I was mentioning, ensuring that they are measurable, realistic, attainable, ensuring that we have a compendium. There's a a rich experience here in the region, a best practice, that we don't just develop the indicators with baseline, we make sure we define them. And we have what we call fichas técnicas in Spanish. We call them compendium of indicators in English, where you detail where is the source of information, how do we measure it. Everybody understands how this is being measured. And this is something that has been very useful in doing the joint assessment of outcome indicators with our member states over the last 10 years. The sections of the document will be completed based on your guidance from this meeting, but also based on the additional consultations, refining the theory of change, and outlining accelerators. An important aspect of this plan, as you notice from the theme, is where do we have the opportunities to leverage innovation, to leverage new ways of doing work so that we can accelerate progress. So something new that we're looking into, again here, in collaboration with all the teams here at your secretariat, but also with you. We will be discussing that in the subsequent consultations as well. We will review our assumptions. I want to caution here that, as you know, every plan it's not static. We need to remain responsive to the situation. So we're looking at our assumptions, foresight methodology to ensure the plan is future-proof. And also, a recommendation that came from the external evaluation of the current results approach is that we have mechanisms in place to adjust the plan during implementation, both with criteria. And that's something that is built into the plan. So if anything happens as a good planning exercise, we should review and adjust so that the plan remains true to the times, but also not just changing the goalpost for the sake of accommodating a result. And finally, closing with the results-based approach. We will update this based on all this rich input and experience that we have. Members, states, delegates, just to highlight here, we continue to communicate through the website. Everyone can see this. And we also have developed some communication materials. Communication is important. Our deputy director always reminds us we need to communicate, especially our results in health or proposed strategies. And there's a website for the strategic plan as well. With that, I'd like to thank you for your attention and looking forward to address any questions, comments. Welcome your comments and suggestions so we can continue building forward this document, this strategic document that's important for the region, but most importantly, the peoples we serve. And hopefully, by the end of 2021, we can see that horizon in improving the health of peoples, especially for the new generations. Thank you so much, Madam President.
Thank you very much for a very comprehensive presentation, and I guess there will be some comments about it. So, me gustaría conceder la palabra al Pleno para cualquier comentario que hubiera. Por favor, México tiene la palabra.
Gracias, Presidenta. Muy buenos días a todas y todos. La Delegación de México agradece la presentación del documento y reconoce la importancia del proyecto de Plan Estratégico 2026-2031 de la OPS como un marco integral para orientar los esfuerzos regionales en materia de salud. En este sentido, valoramos la alineación del documento con la Agenda de Salud Sostenible para las Américas 2018-2030 y con los Objetivos de Desarrollo Sostenible, así como su énfasis en la equidad en salud, la resiliencia de los sistemas sanitarios y el fortalecimiento de la gobernanza en salud pública. Al respecto, con beneplácito mencionamos que México ha participado.
Perdón, tenemos un problema con la interpretación, entonces nos piden unos momentos para arreglarlo.
Bien, gracias.
Perdón. Mil disculpas, podemos reanudar el comentario, por favor. Gracias.
Gracias. Al respecto, con beneplácito, mencionamos que México ha participado en las 4 consultas con los Estados miembros sobre el desarrollo de este plan y ha coincidido en la necesidad de contar con indicadores que se encuentren alineados a las necesidades de nuestros países. En este sentido, se consideran pertinente reforzar algunos de los ejes que México considera relevantes, como tener un mayor detalle en estrategias concretas para la equidad en salud y reducción de brechas socioeconómicas, el fortalecimiento de la infraestructura de atención primaria de salud, financiamiento sostenible y retención del personal de salud, una mayor atención a la resistencia antimicrobiana, salud mental y prevención de enfermedades no transmisibles a través de políticas fiscales, un enfoque más robusto en seguridad sanitaria y preparación ante situaciones de crisis, mayores estrategias de manera más específica para cerrar la brecha digital en salud y mejorar la interoperabilidad de sistemas de información y reforzar la seguridad vial como un tema prioritario de salud pública con indicadores de impacto y estrategias intersectoriales. Tomando en consideración que la última consulta con los Estados miembros se celebró apenas el pasado 13 de marzo, México compartirá con los cuerpos directivos un documento con comentarios detallados sobre el anteproyecto. Muchas gracias y felicidades por la presentación.
Muchas gracias, México. Tiene la palabra Canadá.
Thank you very much, Madam President. Canada thanks the PAHO Secretariat for presenting this draft proposed strategic plan. We appreciate PAHO's efforts to actively engage member states and other partners on this important document, and we look forward to continuing this consultative process in the lead up to the strategic plan's adoption in September. Thank you.
Muchas gracias, Canadá. Tiene la palabra Guatemala.
Muchas gracias, Presidenta. En nombre de Guatemala expreso nuestro agradecimiento al director Ronnie Massa por la presentación del anteproyecto del Plan Estratégico 2026-2031 y también extendemos nuestras disculpas por la ausencia del señor ministro doctor Joaquín Barnoya, que tenía previsto estar presente en esta discusión, pero por compromisos urgentes en Guatemala no le ha sido posible. Valoramos el esfuerzo de la OPS por articular el plan estratégico en concordancia con la hoja de ruta aprobada en septiembre pasado y las lecciones aprendidas del actual plan estratégico 2020-2025. Vemos con buenos ojos la simplificación del marco de resultados y el uso amplio de datos y estadísticas, lo que permitirá una mejor integración y claridad en el seguimiento de los avances en la región. En ese sentido, la alineación entre las líneas de financiamiento y los resultados esperados es crucial para garantizar el logro de los indicadores y metas planteados. Queremos subrayar la necesidad de que el nuevo plan estratégico contemple estrategias flexibles, como bien lo mencionaba el director Massa, que permitan dar continuidad a programas cuyo financiamiento ha sido cancelado o disminuido debido a la coyuntura actual. La crisis sanitaria provocada por la pandemia nos dejó lecciones fundamentales y también puso en evidencia que la organización puede perseverar y adaptarse a los desafíos actuales. No podemos permitir que retrocedan los avances alcanzados en materia de salud pública. En ese sentido, el éxito de la implementación de este plan depende del compromiso de los Estados miembros con sus objetivos y del apoyo que brindan las personas encargadas de implementar sus programas. En particular, el Objetivo Estratégico 5 sobre liderazgo, gobernanza y desempeño de la OPS debe reflejar el compromiso de la organización con la sostenibilidad de sus intervenciones en la región y con la estabilidad del recurso humano de la misma. En ese sentido, es esencial que los estados, con el apoyo del liderazgo de la OPS, continuemos trabajando y continuemos abogando por la participación activa de la región en la gobernanza de la OMS, asegurándose que las contribuciones y prioridades de la región se vean debidamente representadas a nivel global. Señora Presidenta, por otra parte, y en línea con los objetivos estratégicos del plan, reiteramos el interés de los Estados miembros del COMISCA en fortalecer la cooperación técnica con la OPS, la cual ha sido clave para fortalecer nuestras capacidades y responder a los desafíos sanitarios con soluciones contextualizadas a nuestras realidades. Para finalizar, reiteramos el compromiso de Guatemala con los procesos de consulta y construcción participativa de este plan estratégico y confiamos en que este marco orientará los esfuerzos conjuntos en pro de la salud y el bienestar de nuestros pueblos. Muchas gracias.
Muchas gracias, Guatemala. Tiene la palabra la delegada de Estados Unidos.
There we go. Thank you, Madam Chair, and good morning, colleagues. The United States recognizes the consultative approach used to develop the strategic plan and appreciates this update and the work of Ronnie and the entire Secretariat team in bringing us this far along in this really important exercise. As we know, non-communicable diseases are the leading cause of death and disability in the Americas, responsible for 65% of deaths in the region. The strategic plan presents a crucial opportunity to integrate bold, evidence-based NCD policies into regional health priorities. Improved access to primary health care, along with prevention of sickness through the promotion of healthy lifestyles, can help slow the rise of NCDs. We must redirect the focus towards understanding and drastically lowering chronic disease rates and ending childhood chronic disease. And this includes fresh thinking on nutrition, physical activity, healthy lifestyles, over-reliance on medication, the effects of new technological habits, environmental impacts, and food and drug quality and safety. The United States notes the strategic plan's focus on efforts to contain and eliminate diseases and strengthen readiness and response to health emergencies. Madam Chair, my delegation is concerned, though, to see that the strategic plan fails to use precise language regarding the biological reality that there are two sexes, male and female. President Trump has set a clear and overdue course correction on gender ideology, and we must acknowledge the biological realities of sex. These sexes are not changeable and are grounded in fundamental and incontrovertible reality. When discussing sex-based distinctions, PAHO should reconsider the use of the term gender in all applicable policies and documents, including the strategic plan. We look forward to working with PAHO and other members to ensure all PAHO programs defend women's rights and protect freedom of conscience by using clear and accurate language and policies that recognize women are biologically female and men are biologically male. U.S. funds will not be used to promote gender ideology in defiance of biological reality, nor on radical and wasteful DEI programs. In addition, DEI and DEIA policies threaten the safety of men, women, and children by diminishing the importance of individual merit, aptitude, hard work, and determination when selecting people for jobs and services. People should not be stigmatized, demeaned, or shut out of opportunities because of their race or sex. Accordingly, it is the policy of the United States to promote individual initiative, excellence, and hard work, and to reject DEI and DEIA initiatives. In conclusion, the United States urges international organizations to avoid divisive cultural causes and maintain focus on their core mission. These constant forays into controversial social issues, at odds with the sovereign prerogatives of member states, represent one of the main reasons President Trump ordered an examination of U.S. participation in multilateral organizations. Madam Chair, my delegation looks forward to continuing to work with other member states and the Secretariat to further refine the strategic plan in the coming weeks to ensure that it responds to member states' priorities and leverages PAHO's unique value. Thank you, Madam Chair.
Thank you very much. Brazil.
Muchísimas gracias, señora presidenta. Thank you very much. We thank Mr. Massa for the presentation on the draft proposed strategic plan 2026-2031. Brazil appreciates the continued opportunities to discuss and contribute to the development of the plan. We particularly acknowledge PAHO's efforts to incorporate the feedback provided by member states, and we also recognize the importance of consultations with stakeholders. Brazil recognizes that we are on track to having a coherent plan that is highly supported by member states, reflecting the priorities and most pressing needs of the region for the next 5 years. We highly value the evidence-based, results-oriented approach and the centrality of indicators. Since the document presented before is of a substantive nature, I'd like to take the opportunity to reiterate and highlight some comments on certain areas of this strategic plan. Regarding social determinants of health and risk factors, we recommend including the vulnerability of persons with disabilities, considering their intersectionality with other social determinants and ensuring more comprehensive and inclusive health policies. While recognizing the central role of primary health care, we suggest also addressing essential specialized care and continuity of care, which should be supported by the integration of information and technology advancements across the entire health system. It also supports strengthening measures to prevent and control risk factors for NCDs. This includes expanding policies on regulating ultra-processed products, restricting harmful product advertising, and appropriately taxing tobacco, alcohol, and sugary drinks. We particularly suggest strengthening the focus on the impact of early exposure to NCD risk factors, especially amongst children and adolescents. In light of environmental challenges affecting public health, we would also like to highlight the importance of addressing the growing impact of plastics and electronics on environmental contamination and human exposure to toxic substances. Brazil also considers it crucial to have a specific focus on indigenous health, given the significant disparities in access and quality of healthcare, particularly in neonatal and child care. It will allow for more in-depth discussion on targeted strategies to ensure equitable and culturally appropriate care for those populations. We further suggest strengthening vaccine safety monitoring and promoting vaccine confidence, as well as the inclusion of indicators related to health workforce, particularly regarding training and continued education to ensure preparedness and rapid response to future endemic and pandemic events. In the field of health surveillance, we suggest that actions go beyond early detection to also include prediction of public health events, using tools capable of identifying early changes in the occurrence patterns of health events captured in health information systems. Finally, Madam President, Brazil reaffirms its commitment to strengthening public health policies in the region and our active collaboration with PAHO to ensure a robust, inclusive, and effective strategic plan aimed at achieving the objectives of the Sustainable Health Agenda for the Americas 2018-2030 and the Sustainable Development Goals. Thank you.
Thank you very much, Brazil. Now, Netherlands, please.
Thank you very much, Madam President. On behalf of the Kingdom of the Netherlands, I'd like to thank Ronnie and his team and everybody involved for your hard work with regard to the development of the strategic plan. We value the efforts you have taken for bringing us as far as we already got, and really appreciate your active engagement with the member states during the various consultation rounds. The Kingdom of the Netherlands is looking forward to continue working with PAHO in the development of the strategic plan. Thank you very much.
Thank you. Si no tuviéramos ningún comentario adicional, me gustaría darle la palabra al ingeniero Massa para responder a estos comentarios.
Muchas gracias, señora Presidenta. First of all, let me thank the member states, 6 member states who made your interventions. First, for your words of encouragement and appreciation. It really helps our team continue with the energy that is needed to drive this. And I'm sure we speak here of the entire PAHO team, not just in this room, but also across the region in the country offices. As I said, the 3 levels are really working together here to ensure that we deliver on that commitment to your member states of a high quality, the strategic document that responds to your needs and priorities. There are some specific points that we take note on and that we will analyze and ensure that we can come back to the member states in that process, the consultative process that you have approved. We invite you to also send the written comments. We still have some time so that we can benefit from that rich input. And when we have the 5th consultation, we present to the member states in that spirit of dialogue and building together, that we will have then a detailed discussion in that forum so that the member states can have that opportunity, just here in the SPBA, but also the wider member states membership, to review and discuss and agree on a way forward. I just want to reiterate our commitment here to continue refining the document with that results and evidence-based approach, but also concepts, ensuring that we have clarity on concepts. There's a glossary of terms as well. And also on the opportunity with the working group on health equity, where we're also looking at definitions and specific approaches on how to address the key issues mentioned. We welcome the words of bold action, opportunities. This is what we're trying to incorporate in the strategic plan, because really, I don't think the health and well-being of our peoples can wait. And that's the spirit of that message, and we welcome that. Data, yes, important. We continue to look at that, and that's, and again, as we move forward, an advice is if we don't have the data today, that we work on that so that we can have it as a matter of priority, so that we can continue not just measuring, but showing where we direct our interventions on an evidence-based approach. Sustainability, I welcome that, observation on how we ensure that we also are sustainable in our interventions, but with resources, and you will see in the subsequent item that the strategic plan will need the resources to implement it, and also that your secretariat continues to remain responsive. Sustainability is the importance, and governance and leadership. With that, I would just, and also to invite you, if you haven't done so, the prioritization. The prioritization will be key as we guide our interventions. Thanks again to member states. We continue to be engaged with you, and we look forward to hearing your additional comments, but also your participation in the upcoming consultation that we will have with you. Thank you, Madam President.
Muchas gracias, ingeniero Massa. ¿Hubiera algún comentario adicional? Si no, me gustaría darle la palabra al doctor Barbosa.
Thank you, Madam President. I want to thank our member states for the comments that they present today, but also for their active participation in this process. I think that I want to commend our member states and for this process, because I think that's very important, that we cannot only repeat the process that we had 7 years ago in a bureaucratic way. I think that it is really important that our member states are proposing a totally different approach. I think that a much more strategic approach for our strategic plan. The reduction in the number of outcomes from 28 to 12, I think that is really an achievement, because this really is meaning that we are not fragmenting our priorities. I will tell you, I have many years working in public health, and sometimes I could not identify what were the difference between 2 or 3 outcomes that we had in the current strategic plan. So I think that this was a fragmentation of the process. Now I think that you are proposing a strategic plan that clearly is strategic, and at the same time appointing to the Secretariat what are the priorities that we want us to develop during these 6 years. So I think that this is really important. Second, that also this strategic plan is incorporating some lessons that you learn. We cannot have an indicator that you don't have data to measure what's happening. So when we put an outcome, an indicator, we need to be sure that we have the data to follow up, to measure the progress, to identify the gaps, to see how we are progressing. So it's not a wish list, but it's really how we can translate our priorities, the common priorities that you have in our region, to a strategic plan. I think that it's very important, many comments that you made highlighting some aspects of the plan, some changes that you think that are important to be made. We will have 2 rounds of consultations, and of course, if you need more, we will have more. Our role in this process is to facilitate, is to bring you together and to listen and to try to facilitate the process to achieve consensus. It's not easy, because we are talking about a region that is very diverse, as you know. So the priorities sometimes are not exactly the same when we are talking about the Caribbean countries, the countries in Central America, South America, and North America, Canada. So, but I think that again, with this openness, and at the same time this constructive attitude that you have demonstrated clearly so far, I do believe that with these 2 consultations, and if you need more, we will have more. But we will get a consensus and to approve a strategic plan that will guide our action during the next 6 years. 6 years that will be very important. We are still recovering from some several negative impacts of the pandemic, as you know. In many countries, the maternal mortality, that's an excellent indicator of access and quality of care, doubled during the pandemic. We had the mental health emerging as a very serious problem during the pandemic. We have many people with non-communicable diseases that postponed their diagnosis, treatment, surgery. So the backlog in many countries, including developed countries, now is a big problem for the health systems. We need to rethink how we can strengthen primary health care to really be the first line closer to the community, but also that can offer health promotion, surveillance, prevention, diagnosis and treatment for the most common diseases that you have, like diabetes, hypertension, and others. So I do believe that the challenge that the region will face the next 6 years with the discussion that you are providing and the guidance that you provide to the Secretariat approving the SBPA in our directing council, I think that it will be really crucial. So let's get the best of these months that you have ahead to increase the dialogue, to increase the receiving contributions from our member states in order to build the necessary consensus about the main aspects, the main priorities that you have in our in this SBPA. Thank you, Madam President.
Muchas gracias, doctor Barbosa. Informa al subcomité que el debate constará en el informe final. Si no hubiera comentarios adicionales, pasaríamos a nuestro siguiente punto, el punto 3.2. Esquema del presupuesto por programas de la Organización Panamericana de la Salud 2026-2027. Señalo a la atención del subcomité el documento SPBA 19.3 e invito al ingeniero Ronnie Massa a que pudiera hacer, bueno, ya está aquí con nosotros en la mesa y pudiera presentar este punto, por favor.
Muchas gracias, señora presidenta, doctor Jarvas, mesa directiva, distinguidos delegados. Let me switch to English, please. I'm pleased to introduce this item 3.2, which is an outline of the proposed program budget of the organization for the biennium 2026-2027. This is the snapshot of the roadmap that we have also developed based on the overarching roadmap of the strategic plan. So we break down here. You will see some overlaps, of course, because this is being developed concurrently. And just last week, we also had the opportunity to share the proposal that is before you, also in the wider consultation process with our member states. As we speak, we launched the prioritization again, with the emphasis that the budget needs to be responsive to priorities, but to the realities. We launched the prioritization last year with our member states, and that's going to be critical to inform also the budget, not just the overall budget envelope, but also the allocation of budgets at outcome level. We are presenting to you in the SPBA the outline. This is still a very general document as is required, but we also bring some content to you, as you will see in the document. This month, we will continue with our internal discussions. We already had the consultation last week with the member states. And during April, June, as you can see, they're turning the curve as we get to the straight line of June to September, is that we finalize the full document that you will see in the executive committee. But there's an important date there, which is the WHA, the World Health Assembly. As you know, our PAHO budget, integrated PAHO budget, incorporates the AMRO portion. And that decision of WHA usually informs also the PAHO budget. From June to September, we will very much be working on refinements. So we hope that after the executive committee, we will basically work on specific fine-tuning, especially if something emerges during those 2 months, so that we can have a document well in advance for you to review in detail before the September Directing Council. Important, it doesn't stop there. Once you give us that approval, our member states gives us the approval to proceed, we develop operational plans. So we translate your mandate into specific work plans that each entity in the Secretariat develops and our director approves so that we can implement the specific interventions, working with you at the country level and here from the region. The outline before you is a standard document with an executive summary. We look at the programmatic context, the strategic direction of the strategic plan, of course, the proposed budget. And again, just some of you may be new to the concepts here. PAHO budget is an envelope, not funding it. We look forward to funding it, but this is an envelope as we speak. Then we look at financing. I will present an update on that. Important in the contexts that we have adopted also this good practice of looking at risks and mitigation actions as we implement the plan. Accountability continues to be an emphasis and commitment to you to improve where possible. But accountability for results and financial resources, one, the Secretariat, as we look at the results approach, but also with our member states, as we also look at outcomes and impacts, that joint accountability that we do together, an assessment, a good practice that we have in the region. The outcomes are going to be finalized in the strategic plan, and then we have to develop outputs. We are already in that process with our technical and enabling teams to ensure that we have outputs that also are aligned with the proposed strategic plan. Strategic considerations are always important on how we develop the program budget. This is going to be the first program budget of the new strategic plan. So it gives us that opportunity, again, leveraging opportunities on how do we accelerate in the first 2 years of the strategic plan. How do we put in the foundations, the necessary interventions, so that we have conditions that will allow us to propel forward and aiming towards the 2031 targets in the strategic plan, jointly defined, of course, with our member states. Building on the resilient health systems on a primary healthcare approach remains at the center of the sustainable development, but also health for development, health security, and so on. Incorporating lessons learned also important that we continue with that practice in the program budget, and that we address the relevant decisions and recommendations that have come up, including from this from your guidance in this forum, but also in the consultation member states. Increasing timely and equitable access to health innovations, again, leveraging the power of innovation in health for all countries in the region, to ensure that they reach all those who are not being reached at this time, also through the implementation of specific interventions. And of course, again, ensuring that we remain true to you, every opportunity we have of making PAHO modern, agile, responsive, focused on results, demonstrating that contribution at country level, that we are indeed moving the needle, but while we do that, with efficiency, transparency, and accountability. In terms of the budget envelope, the space, as you can see here, it's a flat budget in base programs. That's the blue bar, the bottom. At the time, this is about 2 months ago when we were considering this, we felt that the demands are there. We cannot ignore the demands for technical cooperation from our member states. The priorities are indicating that we need to protect at least the base budget. The other special programs, emergencies segment, that's a placeholder. So we don't normally focus on that. Based on what we can project at this time, we'll continue needing about $100 million as a placeholder in the event of any emergency or crisis that we need to respond to mobilize those resources. In terms of how this program budget should be financed, and again, these are estimated preliminary figures that we have at this time. As you can see, our director, as already mentioned, is not requesting an increase in assessed contributions. Assessed contributions remain at $194.4 million. The budget miscellaneous revenue increases. Our projection at this time is that it will increase to $52 million from 14. This is due to the investment environment higher interest rates as we see, and we continue to invest better here. The voluntary contributions that PAHO mobilizes, and this is important, as you will see, that we are inviting our member states. In addition to the traditional voluntary contributions, we're asking our member states, while we don't ask for an increase in assessed contributions, we're inviting your member states to contribute with core voluntary contributions. We appreciate the traditional approach with voluntary contributions. They are very valuable, but if there's a space for any member states to also contribute with core voluntary contributions, which means they're flexible, to be oriented to the priorities that you define to implement the program budget and strategic plan, we welcome that approach. This is something new that we're incorporating in the PAHO, because we do need those resources to continue to responding to you as you deserve. The other one is the WHO allocation, where you can see those two asterisks, because that's an interim amount still under discussion. The recommendation, as I mentioned yesterday, from the executive board in WHO was that they set a budget at $4.9 billion in base programs, but subject to subsequent consultation with member states. There is a request to WHO that the budget also looks at the financial outlook in a realistic manner. So the reduction already shows that, a slight reduction to the region, but also it also shows the importance of the allocation to the region. And again, this, in an integrated approach to our budget, this budget space is approved so that we can implement and respond to the priorities of the countries of the region. It's an integral part of PAHO's budget. So the AMRO allocation becomes PAHO budget once it is adopted. However, as we know, this is the budget as the WHO, if that was to be approved, as mentioned yesterday and highlighted by the director, that budget space from WHO barely reached about 65% funding. So when that doesn't come, the PAHO voluntary contributions, your PAHO team has to mobilize additional resources. And that's the effort that we normally see, that the PAHO voluntary contributions, that 23%, would likely go up because we would have to cover for the gap that doesn't come from WHO. And again, I want to appeal on the core voluntary contributions where possible, and we can have discussions, of course, on that with our member states. Now, important, as we highlighted yesterday, and you see the flat assessed contributions for the last, now it's 13 years, going for 14 years. When by the time you approve this program budget, the assessed contributions would not have increased for 14 years. And we estimate the impact of that in real terms is a reduction of about $75 million. That is a big toll. And while we continue to invest in efficiencies, and your PAHO teams continue to do everything possible, something has to give. We focus on priorities. We find innovative ways of working. I can tell you the collaboration member states, when somebody was asking me, a delegate was asking me yesterday, how do you do this? Well, we do it by, first, the collaboration member states. There are innovative ways of working with member states when we do country interventions, or member states sometimes co-finance activities at country level. We use technology to do what we have to do. But the impact is there. And while our director and management continue to be very prudent in managing these resources that you entrust upon us, we need your resources. We need your assessed contributions, and hopefully we can get some core voluntary contributions in addition to the traditional voluntary contributions. With that, I'll just like to highlight a few steps here. We would have by next month a document that will be consulted with you with more details before we get to the executive committee. We will then incorporate any final decisions that member states make at the World Health Assembly in terms of budget. It will not affect our priorities. Let me be very clear about that. It's a budget space. It does not affect the content of the program budget when it comes to the programs and the priorities that PAHO will put there based on consultations with you. Completing the prioritization with member states also by next month, and developing and completing something that we always try to innovate here with the limited resources, and using technology, a digital portal where we can make all of this information available to you and our stakeholders, where you can reach it by the click of a button. With that, I thank you. And I look forward to hearing from your comments and questions.
Thank you very much. Ahora me gustaría conceder la palabra al Pleno para iniciar el debate y escuchar sus comentarios. El Salvador, por favor.
Gracias, Presidenta. Gracias, Ronnie Massa, por el informe. El Salvador agradece y reconoce esta presentación. Al mismo tiempo, agradecemos incorporar la palabra innovación. Creo que hoy en día es algo muy llamativo, que está en boga, y al mismo tiempo hacemos una pequeña observación. Si bien es cierto, todavía se mantiene un 42% de los aportes por la OMS, creo que la reducción, aunque sea mínima, digamos, es importante que no siga disminuyendo, ¿verdad? Y como tú lo mencionas, en la reunión de la Asamblea Mundial de la Salud en mayo, es importante que como Estados miembros de la OPS aboguemos para que esto no disminuya o continúe disminuyendo y se mantenga. Al mismo tiempo, sea más atractivo también para los demás. Muchas veces pensamos de la manera tradicional, pero muchas veces hay que cambiar esa visión. Entonces, tenemos que hacer más atractivas las maneras en las cuales estamos consiguiendo los fondos también, ¿verdad? Mostrar más, quizás cambiar la estrategia de comunicación para que sea más visualmente atractivo a externos y de esta manera lograr conseguir más fondos para todos estos planes estratégicos que tenemos, que los cuales apoyamos porque se alinean con nuestras líneas estratégicas, valga la redundancia, que tenemos en nuestro país y creo que en los demás Estados miembros. Muchas gracias.
Muchas gracias, El Salvador. Ahora me gustaría darle la palabra a Canadá.
Thank you very much, Madam President. Canada would like to thank the Secretariat for this outline of the program and budget for 2026-2027. We recognize the particular importance of this program budget, as it will be the first under PAHO's new strategic plan. In reviewing the different financing sources for this proposed program and budget, we note a significant decline in funds from PAHO voluntary contributions and other sources compared to the current budget. Further, we see that WHO's allocation to the region continues to correspond to 42% of the PAHO budget for base programs, which remains a significant portion. Recognizing that the WHO budget will only be adopted in May, we encourage PAHO to continue to remain prudent, implement efficiencies, and continue to plan for potential gaps in funding. We look forward to seeing the detailed budget that will be presented to the Executive Committee in June. Thank you.
Thank you very much, Canada. Now, the United States, please.
Thank you very much, Madam Chair. We appreciate this program budget outline, and we look forward to further discussions and consultations on the proposed 2026-2027 program budget, especially once we have the full document for review. The United States notes that the program budget will reflect PAHO's strategic plan 2026-2031, and would refer to some of our comments on the strategic plan on the previous item. We would also urge caution in aligning the proposed program budget with WHO strategic priorities and work. The focus should be on the health goals and objectives of the region. And it was encouraging to hear that once WHO funds come to the region, it becomes PAHO. It becomes the PAHO budget. And so that is on the right track, and want to ensure that that continues to be the case. Looking at expected revenue for the budget, the proposal shows an estimated miscellaneous income more than tripling from $14 million to $52 million due to income earned from the previous biennium. And it was noted that this was related to investments. So could the Secretary please advise what kinds of investments this money accrues from, and why is it expected to be so much higher than the previous biennium? It's great to see expected increase in income, but that is a large increase. And in particular, since the increase in miscellaneous income is projected to help cover the gap of declining voluntary contributions, it will be important to understand how likely that is to happen, And we would also like to know if the Secretariat expects to have a more accurate estimate of that amount further down the line when the budget is presented for final adoption. Regarding national voluntary contributions, we are encouraged that the funds are subject to PAHO's financial rules and regulations. However, could the Secretariat please confirm whether these voluntary contributions are reported in the same way as other voluntary contributions within the financial reports? There are reasons to count all of the contributions together, but we want to ensure that we clearly define when member states are providing contributions that benefit the organization and others versus those that benefit primarily themselves. Thank you very much.
Thank you to the United States. Now I would like to give the word to Guatemala.
Muchas gracias, Presidenta. Mi delegación quisiera expresar, en primer lugar, su reconocimiento al equipo de la OPS por la elaboración del esquema de presupuesto por programas 2026-2027. Creemos que este documento refleja un esfuerzo significativo por atender las crecientes necesidades de los Estados miembros en materia de cooperación técnica y al mismo tiempo busca optimizar los recursos disponibles en un contexto de desafíos financieros y coyunturales. Reconocemos en particular la versatilidad y compromiso del personal de la OPS, que ha demostrado una capacidad excepcional para adaptarse, innovar y mantener la calidad de su labor, a pesar de las limitaciones presupuestarias y el hecho de que las contribuciones señaladas no han sido incrementadas en más de una década. La resiliencia de la organización y su capacidad de seguir brindando cooperación técnica efectiva es en verdad un testimonio del compromiso con la salud de la región. En ese sentido, Guatemala aplaude la creación de la nueva modalidad de financiamiento a través de la contribución voluntaria básica y un mecanismo diseñado para reducir brechas de financiamiento y fortalecer la sostenibilidad del programa presupuesto. Esperamos que este mecanismo permita e incluso ampliar las capacidades de la OPS para responder a las solicitudes de cooperación técnica de los estados y pueda brindar mayor estabilidad financiera a la organización en el largo plazo. Asimismo, queremos enfatizar la importancia de que el programa presupuesto mantenga flexibilidad y coherencia con las prioridades nacionales de los Estados miembros, ya que cada país enfrenta desafíos únicos y es esencial que la asignación de recursos permita respuestas adaptadas a nuestras realidades específicas. Además, consideramos fundamental que la sección de riesgos y medidas de mitigación contemple no solo los retos sanitarios, sino también los riesgos socioeconómicos y políticos que puedan impactar la implementación de los programas. La planificación estratégica debe incluir mecanismos proactivos que permitan a la OPS y a los Estados miembros anticiparse y responder con agilidad a estos desafíos. Para finalizar, reiteramos nuestro compromiso con el trabajo de la OPS y nuestra disposición a seguir participando activamente, abogando por las prioridades regionales en la OMS, como bien lo mencionaba el colega El Salvador, y que coadyuve a la construcción de un presupuesto que garantice el acceso equitativo a la cooperación técnica en la salud. Muchas gracias.
Muchas gracias, Guatemala. Brasil, por favor.
Muchas gracias, Señora Presidenta. Brazil thanks Mr. Massa once again for the presentation of the outline of the program budget for the next biennium. As recognized in the document, the program budget should align with the future strategic plan, operationalizing it, and other key thematic strategies and mandates. Brazil recognizes the great efforts made by PAHO leadership to propose a zero growth budget for base programs and an overall reduction with respect to the previous biennium. While costs keep rising, especially in the headquarters, we must adapt to the realities of member states, including in many of them, a limited investment capacity in the wake of COVID-19 and other crises. Brazil specifically salutes the open and transparent manner in which the PAHO leadership has addressed the current financial challenges facing the organization. While the existing difficulties cannot be understated, this context can and should be used as yet another demonstration of the clarity of purpose and the ability to achieve shared objectives and goals in the Americas through evidence-based dialogue and cooperation. Brazil is confident that PAHO will come out stronger and with even greater support and trust by its members. Madam President, with initiatives such as PAHO Forward, we're glad that the organization has been able to achieve efficiencies and keep discharging its mandate to provide technical assistance to the region and helping build stronger and more resilient health systems. Also, Brazil recognizes the strong efforts by PAHO to diversify its sources of funding and support and encourages further resource mobilization. Finally, Brazil highly values the consultations taking place for the development of the program budget. We considered stakeholder participation a crucial aspect of the process, particularly in this moment when the organization needs to broaden its partnerships. Brazil reiterates its engagement with the design of the program budget and looks forward to the opportunities to contribute to the discussions. Thank you.
Thank you very much, Brazil. Mm. Would we have any other comment before opening to answers? Costa Rica, por favor.
Gracias. Disculpe porque llegué tarde, estaba en una reunión, pero justo el día de ayer estábamos conversando sobre este tema y quería comentar al respecto. Principalmente porque creo que es para todos conocido que los cambios geopolíticos en alguna medida nos llevan a anticipar escenarios y en ese anticipar escenarios deberíamos hacer previsiones acerca de cuál va a ser la sostenibilidad en esos escenarios de lo que es, creo que la estrategia que todos sabemos, apostamos y queremos que se mantenga, que es la OPS. Y ante las reducciones de presupuesto y sobre todo a sabiendas de que todos los entes que estamos aquí sentados pagamos 2 membresías, ¿cuál podría ser ahora sí dentro de esos planes A, B, C, D, ¿verdad? Estrategias para no solamente redireccionar lo que nosotros apostamos y pagamos ya a la entidad que de alguna forma tenemos afianzada, nos colabora y tenemos de alguna manera ya una relación estrecha y así que sea mediante la OPS que se puedan direccionar estos recursos, pero a sabiendas de que ya nosotros estas 2 membresías las canalizamos por una sola entidad. Esa es una propuesta, una forma de validar y una forma también de saber que ustedes de alguna manera no van a estar luego con reducciones de presupuesto en una región que tiene grandes necesidades. Más allá de esto, creo que en la dinámica también de lo que son las gestiones administrativas presupuestarias de cada uno de los países, la anticipación es importante. Porque si los cambios de alguna forma los solicitan en un momento en que nosotros tenemos que de alguna forma generar cambios, ustedes saben que casi que duran un año presupuestario. Y ahí es donde la anticipación, nuevamente lo recalco, es importante y las previsiones presupuestarias aún más. Y les voy a dar caso concreto de Costa Rica. Costa Rica, yo, para poder hacer un cambio y una modificación desde ya, estamos elaborando todo lo que son las mejoras, modificaciones o sumas presupuestarias para poderlo ir a defender en septiembre, octubre a la Asamblea Legislativa para poder tener al otro año el presupuesto. Vean la anticipación. Ahí es donde nosotros, si no generamos una visión a futuro de lo que se tiene que hacer, la mecánica de cada uno de los países es lenta. Y todos lo sabemos, la administración pública no responde tal vez a las necesidades que tenemos a nivel local. Y algo también que espero que de alguna forma se haya, digamos que quedado claro, es la distribución de ciertas, digamos, presupuestos en líneas de trabajo estratégicas que de alguna forma no podemos prescindir, como es la atención de emergencias y de alguna forma la visualización que podemos tener en la vigilancia de enfermedades en la región. Esto sería el aporte. Gracias.
Muchas gracias, Costa Rica. Si no tuviéramos más comentarios, me gustaría regresarle la palabra al ingeniero Massa.
Gracias, señora presidenta. Y gracias a los 6 estados miembros que nos aportaron con sus intervenciones, sus sugerencias y sus preguntas. I may switch to English, please. I think we have sort of reflections. Welcome the reflections. Welcome the suggestions on how we continue to ensure that the full document will consider all this input that you have given us, but also ensuring that it is a budget that is realistic, that addresses these comments you've made, and we made sure that we took note of that, but also in the subsequent discussion with member states, we'll see if there's anything else to fine tune. But let me welcome first the encouragement for continuing innovating, to continue advocating, and please, we count on you, and we thank you for that advocacy with WHO as well. It has paid off. We showed you yesterday that we have been getting more resources, and And yes, protecting the budget. It's already, as Director Jarvis mentioned yesterday, the region already has the smallest budget allocation among our regions, and that should not be affected anymore. We also take note of your advice on continued commitment to prudent management and to ensure that we consider scenarios as we move forward. Let me highlight here that the proposal before you, developed about 6 weeks ago, looked at the times. The financial outlook was an important, but also a historical budgeting approach that we use here, but also scanning the geopolitical scenarios, external factors. Those are considerations we have taken very seriously in the analysis, and we'll continue to do so as the times are very fluid. And the discussions in WHO are also, we will remain vigilant and ensure that the document will reflect what needs to. In terms of questions, I noted here 3 questions, specific questions. One is on the PAHO voluntary contributions. Yeah, let me just tell you that's the budgeting part. That's to balance the budget, we put a smaller amount there because the AMRO portion is there, that 42%. The reality is that we mobilize more resources as PAHO voluntary contributions. The real funding will show that we mobilize more than that. Yesterday, our directors, in the financial report, you will see that we do mobilize more than what is put in the budget, pretty much as a placeholder, just to balance the budget and don't increase it because WHO's allocation is there to the region. And the commitment is to continue doing, as you say, diversifying, strengthening partnerships, and our colleagues in external relations and led by our director here and everybody here in PAHO, technical teams, country offices, everybody is doing their part to mobilize additional resources to respond to the priorities of your member states. Miscellaneous revenue, yes, indeed. Let me be very frank about that. One is the fact that we were very conservative in the past of putting a $14 million. Last biennium, as you will recall in the SPBA, we presented to you, last year, and the executive committee approved the revenue surplus, which exceeded $30 million. So we have been investing more, being more prudent with the investment of the portfolio, and in the financial report, you would see those details on how those investments, the interest rates is one factor, but indeed it was also, the explanation is simple. We were conservative. We have been getting more returns on the investment, and this number just adjusts to the reality. So I'm more accurate. We will continue to review and update as necessary between here and June, but that's the closest, the best estimate we have at this time. You will also see details when we get to the closure of the biennium of what will be the projected revenue from that source also as we close the biennium through our financial reports. National voluntary contributions, the answer is yes. They must adhere to PAHO's financial rules. All funds that come to PAHO are managed, be it WHO, be it national voluntary contributions, are managed according to PAHO's rules and are aligned to PAHO's programs. It has to be aligned with the program budget and strategic plan. With that, Madam President, just to thank member states again, please continue to be vigilant with the discussions in WHO, and I will be in touch with you through the upcoming consultations, and looking forward to get your additional comments through that forum as well. Thank you, Madam President.
Thank you very much. Now, me gustaría darle la palabra al doctor Barbosa.
Gracias. Muchas gracias, senhora presidente. Agradeço a todos os comentários que nossos Estados-membros fizeram. Tomamos nota, vamos, com esses comentários, eu creio que perfeccionar o documento que vai ser apresentado para o Comitê Executivo. Estamos falando de pressuposto que todavia tem grado importante de incertidumbre. Eu creio que, para ser muito transparente com vocês, seguro que, a depender de las discussões e de lo que vai ser apresentado durante a Assembleia Mundial da Saúde, vamos quizás ter a necessidade de revisar o documento que vai ser apresentado para o Comitê Executivo. Ou seja, eu creio que é importante ter isso em conta. O pressuposto sempre tem que ser balance entre ser realista, e, ao mesmo tempo, ter uma ambição de mobilizar recursos para aliená-lo, porque, como esse é um envelope, né? É um sobre, não estamos falando de fundos reais. Né? Em geral, esse, por exemplo, no pressuposto, a porção de la OMS é 42, pero quando historicamente só recebemos ao redor de 60, 65%, em verdade chega ao máximo de um terço do financiamento real da organização. Né? Já por contribuições voluntárias, com o esforço que estamos fazendo de ampliar a base de sócios, de donantes, e temos uma tendência de incrementar essas contribuições. Ou seja, seguro que quizás vamos a ter que fazer algum cambio, pero la propuesta es de mantener el mismo presupuesto con una reducción de la parte de emergencia, porque como todos los fondos relacionados a la respuesta a la pandemia están decreciendo, porque ya no estamos más en una pandemia, no hace sentido mantener el mismo nivel de presupuesto. Pero para los programas base, mantuvimos el mismo nível, né, com a expectativa do que vai passar com as discussões na Assembleia, e reitero de novo, eu creio que é o compromisso dos países da região da necessidade de distribuição equitativa, né, de los recursos. Creio que também agradeço todas as sugerências, comentários, né? Sim, estamos muito comprometidos em seguir com uma política muito prudente, como já implementei desde o começo de meu mandato, né, em termos de buscar eficiências, né, de reduzir gastos desnecessários, de reduzir a burocracia innecessária, ou seja, de fazer com que a organização seja mais eficiente. Né? O tema de revenue surplus, que já foi explicado por Rony Mava, pero recuerden que durante muitos anos a taxa de interesse em Estados Unidos foi zero, quase zero, né? E agora não é mais zero. Então, isso eu creio que de alguma maneira nos ajudou, e também atendendo a uma recomendação, following let me switch to English, following a recommendation from our external auditor, I made changes in our the committee that supervises the investment portfolio. So now we have external members, and being prudent, but now I think that we have diversified more our portfolio in order to protect and to benefit more from our investment. So this is the main explanation. Of course, we will not have the same performance next biennium, but I think that it's good to have this increase, this surplus, because it's covering all the gaps that you have in the financial situation for the year 2005. So this is allowing us to be in a more healthier situation, let's say so, during this year. So I really appreciate all the comments, suggestions, and pending the discussions during the World Health Assembly, but I think that is at the same time a realistic budget, but a budget that is challenging us to mobilize more resources from voluntary contributions and other sources. And I just want to make maybe a suggestion. Let me switch to Spanish. Muitos países, em verdade, com o câmbio de la tabla de contribuições de Nações Unidas, mesmo com a aprovação de 20% em las cotas para a OMS, em termos reais, vão ter uma redução de quanto pagam. Eu queria invitar a los países que tenham uma redução que puedan transformar esse ahorro que vão ter em contribuições voluntárias para a OPS. Ou seja, poderia ser uma maneira, seguro, é gasto que já está no pressuposto de los países, que se não se utiliza para isso, se vá para outras áreas, e se poderia ter essa redução que muitos países vão ter como uma contribuição voluntária para que se pueda llenar más los gaps que todavía tenemos del presupuesto. Entonces, es una invitación a una mayor solidaridad en la región. Muchas gracias.
Muchas gracias, doctor Barbosa. Si no me equivoco, vamos a pasar a... Muchas gracias. Informo al subcomité que el debate constará en el informe final. Y también les anuncio que pasamos a un receso de café de media hora. Entonces, nos encontramos aquí de nuevo a las 11:10, por favor. Gracias.
Le estaba dando así picazón y arde mucho y no sabía si es esa enfermedad lo que tengo. Pero como cabal vinieron los personal de salud aquí en mi casa, entonces me detectaron digamos, el tracoma, que vinieron en el centro de salud y me hicieron la operación de mi ojo. Pues por el momento, y gracias a Dios que ya lo veo muy bien y ya no sentía ¿cómo se llama? La picazón, lo que me estaba dando antes, en cambio ahora sí ya me sentía bien por el ojo que me operaron. Y además estoy agradecido con el personal de salud y tanto la OPS que vinieron en el centro de salud, me hicieron esa operación y yo estoy agradecido con ellos por todo lo que me hicieron. Ahora soy libre del tracoma.
With the rising prevalence of non-communicable diseases, the Ministry of Health and Wellness believes, supported by the European Union's Health Sector Support Program, EUHSSP, and PAHO, is proactively strengthening its health system. Through the development of targeted policies and collaborative frameworks, the nation is addressing these challenges on multiple fronts. From integrated primary care services, building capacity of healthcare workers, to empowering communities, strengthening health systems, saving lives.
In Belize, over the last 5 consecutive years, non-communicable diseases have been in the top 5 causes of morbidity and mortality for our country. So we knew that we needed to address this head-on. We were able to successfully launch our nutrition policy, and we were able to put a nutrition plan with objectives onto this policy.
And the support that is being provided to the Ministry of Health and Wellness for the development of the National Cancer Plan and the National Cervical Cancer Plan will also contribute to ensuring the management of non-communicable diseases.
By defining clear objectives and strategies, we are building a future where NCDs are effectively managed and the health of our population is prioritized. Integrated health service delivery networks are revolutionizing healthcare delivery in Belize. By ensuring comprehensive care at the primary level and bringing services closer to where people live, these networks are making a significant impact.
Through integrating the comprehensive management of non-communicable diseases such as hypertension, cardiovascular disorders, also mental health conditions, this really helps to strengthen the capacity of primary care providers and also community health workers in the knowledge and understanding of prevention and management of these conditions.
By standardizing care with global best practices and introducing new treatment modalities, healthcare professionals are better equipped to manage chronic illnesses. Health education is a crucial element in preventing and managing NCDs.
Through PAHO, we have been able to successfully, over the last 12 to 18 months, do caravans in some of the least accessible places, very rural communities that had significant population. So the health caravans were basically a fair for the community to come out, learn more about health in different aspects. The blood pressure was done, your weight, your height, your body mass index. The pharmacist was there, nutritionists were there to give nutrition counseling. It was just an effort to try to improve health literacy in the hardest to reach populations.
By empowering communities with knowledge and education, we can inspire behavioral change and improve overall health outcomes. Access to essential medical equipment is vital in the early detection and management of NCDs. With the right tools, our healthcare providers are better equipped to serve the community.
There are a number of new blood pressure measuring devices that have come onto the market, but it is important to ensure that these are clinically validated so that the readings that we receive from them are accurate. In order to ensure that as we roll out the HEARTS initiative for the proper management and control of hypertension, we want to ensure that the equipment that are being used in the primary care facilities have been standardized.
The National Cancer Plan and the National Cervical Cancer Plan are groundbreaking initiatives aimed at reducing the burden of cancer across the country.
Through the EU project, PAHO has been able to give us tremendous technical cooperation for us to have a very solid and usable plan when it comes to reduction of all cancers, not just cervical cancer, but it's the National Cancer Plan.
The important thing about cancer and any cancer plan is to ensure that it is very comprehensive and covers the broad spectrum from prevention to rehabilitation and to care at the end of life. In addition to that, the clinical management. How do you diagnose? How do you manage these conditions? Which medications to use? So those are components that are also in the plan.
Together, with the support of our partners and communities, we are building a healthier, stronger Belize. One step at a time, we are ensuring better care for NCDs through integration in primary health care.
Amid a challenging security environment, vital work by the Ministry of Public Health and Population is strengthening routine immunization services in Haiti. Supported by PAHO and funded by the Canadian government through the Can Give initiative, these efforts seek to ensure equitable access to life-giving vaccines for vulnerable communities and groups, including girls and pregnant women. Through 3 regional exercises, 105 department-level trainers receive important updates on vaccination norms and protocols, including on COVID-19 vaccines, which have been integrated into Haiti's national immunization program. Through cascade training, these regional trainers then share their knowledge with nearly 400 health providers. In addition, 124 health providers involved in epidemiological surveillance were trained in specific protocols for surveillance of vaccine-preventable diseases. And 221 health facilities benefited from supportive supervision to ensure their compliance with vaccination quality standards. In 2024, more than 421,000 Haitian children received critical vaccinations through catch-up campaigns and routine services. And as Haiti faced recurring cases of deadly diphtheria, PAHO supported the vaccination of more than 340,000 children against the disease.
Oh oui, vaccin li gen an pile importance dans cadre routine et raison c'est parce que gen zone qui vraiment éloigné. Des fois, parents pas de possibilité pour les mener ti moun dans centre là pour les venir faire vaccin. Hein? Des fois, négligence parents tout et les nouveaux équipes sur terrain comme ça a vraiment aidé parents yo, aider ti moun yo pour capable joindre vaccin dans localité côté que yo vivre là.
Des maladies évidentes par la vaccination, nous apprenons et diphtérie. Effectivement, c'est un cas de diphtérie suspect que l'équipe aidée là a fait réponse. Et nous en pleine activité de réponse. J'en ai remarqué, nous cherchons rougeole, rubéole, nous cherchons syndrome rubéole congénitale, qui est moins d'un an. Nous cherchons catankou paralysie flasse aiguë. Nous cherchons surtout Kaiti et moun qui gen moins que 15 ans.
HEARTS is an initiative of the Pan American Health Organization and the Ministry of Health, which aims to improve heart health and save lives by standardizing hypertension treatment, promoting healthy lifestyles, and strengthening primary health care.
The chronic non-communicable diseases are the leading cause of death in Grenada. Within the top 3, we have the cardiovascular diseases. For these reasons, we welcome the introduction of the HEARTS Initiative.
At the core of the HEARTS Initiative is the HEARTS Protocol, which provides a standardized approach to hypertension management and cardiovascular disease prevention in primary health care. It includes standardized treatment, effective and accessible medications, risk-based care, team-based approaches, healthy lifestyle promotion, and the strengthening of primary healthcare systems.
The integration or initiation of HEARTS has introduced a standardized approach to the way we manage high blood pressure patients.
The HEARTS protocol includes simple, standardized, proven treatments and interventions that can be easily incorporated into primary health care.
As part of the HEARTS program, we have standardized blood pressure reading, ensuring that all categories of staff know how to check blood pressure. So in case a patient comes to the facility, anyone can assist them in checking their blood pressure.
The HEARTS protocol emphasizes a team-based approach which expands the responsibilities of hypertension management beyond primary healthcare physicians to include nurses, pharmacists, nutritionists, and other healthcare professionals, so that they too play a significant role in saving lives.
As nurses, we ensure that our patients are compliant, making sure that they monitor their blood pressure as often as possible, take the medication, come to visit the doctor when they are low on the supplies, follow up with the nutritionist as well. And if they have any issues or concerns that they are, feel free that they can come in. If they're not feeling well, they could come in at any time and speak to any one of us for advice, and we can do the proper referral if it's hospital or to doctor.
So as nutritionists and dietitians within the healthcare, whether it's primary healthcare or secondary care, we employ what is called medical nutrition therapy. This involves doing a comprehensive assessment. We look at body measurements, we look at the biochemical markers, the labs and so forth. We look at lifestyles, we look at dietary indication, and we also do a full physical exam. Once we're completed, we do a nutrition diagnosis, and then we will recommend and put together a targeted care plan with interventions as to how we can get that person to improve the overall lifestyle. So whether it's becoming more physically active lifestyles, whether it's changing diet, whether it's ensuring that person gets adequate amount of nutrients and filling the gap where there are deficits. We know that if we can correct the diet, also if we can maintain an adequate foundation for health, we know that we can see better outcomes when it comes to heart health.
The HEARTS protocol emphasizes the use of effective, affordable, and widely available medications to improve hypertension management.
The medicines that we'll be using
Hola, ay. ¿Ya?
Cuando se pone así, puede poner ahí y después de nuevo ahí. Aparece la lista. Ok.
Hola, los invito a que tomemos asiento para continuar las discusiones, por favor. Gracias. Entonces, continuamos con el siguiente punto de agenda. Punto 3.3, escala de contribuciones señaladas para el 2026-2027. Señalo la atención del subcomité el documento SPBA 19.4 e invito al ingeniero Ronnie Massa, director del Departamento de Planificación, Presupuesto y Evaluación de la Oficina Sanitaria Panamericana, a que se acerque a la mesa principal y presente el punto.
Thank you, Madam President. Director, at table, distinguished delegates. I am pleased to introduce item 3.2, the scale of assessed contributions for the biennium 2026-27. According to Article 24A of PAHO's Constitution, its member states are assessed at the same level as the Organization of American States. So we rely on the OAS scale, and then we apply it here at PAHO. The proposed scale of assessed contributions, therefore, will be important as we proceed to implement the next strategic plan and our first program budget, 26-27. And in the program budget is where we will apply, once there is a decision on the OAS scale, the level of assessed contributions. The amounts will be then included in that proposed program budget at that for that total of $194 million that you saw in the previous item. In keeping with PAHO's constitutional mandate, the scale of assessments to be applied by the Secretariat for the next biennium will depend on the outcome of discussions of the 55th regular session of the OAS General Assembly regarding its own scale of assessments for the period 2026 and beyond. We understand that there are ongoing deliberations about this at the OAS. And based on that outcome, we are collaborating with our colleagues. And when such a decision is made, we will then provide to you for the Executive Committee the application of that scale. We expect those discussions to continue through May up until June, when the Assembly should meet and hopefully adopt the new scale. And at that time, we will need to update, and that puts us in a bind here with the timeline, because as you know, we need to submit the documents 6 weeks in advance for your consideration. So we'll ask for some flexibility as we continue to wait for that outcome of the OAS assembly. The scale is then adopted here so to apply to other member states, that associate members, participating member states, and we have a methodology for that in a document that your member states approved in a document called CD 6055, and you have the reference in the document there when you made those approvals, so that we, the Secretariat, can apply that to those member states that are not covered in the OAS membership. If the OAS Assembly does not adopt, if by any chance then we have a mechanism to apply an interim measure where we will extend the scale that we have and continue operating. Of course, we will not stop operating and implementing our program budget. Of course, that will also be tabled for your consideration at the Executive Committee, if that scenario is to play out. Therefore, you will see the document is very brief, as we just have an outline at this time. And hopefully, we will have the OAS assemblies results, and when they become available, we will update the document accordingly. We welcome your comments at this time, any guidance that you can provide us. Thank you very much, Madam President.
Thank you very much. Now, if you would have any comments on this issue. Mexico, please.
Gracias, Presidenta. México quiere dar las gracias por la presentación de este informe sobre la escala de contribuciones señaladas para el periodo 2026-2027 y se reconoce el esfuerzo de la OPS por garantizar un proceso transparente y previsible en la determinación de las contribuciones de la membresía en estricto apego al marco normativo de la organización y en concordancia con la escala de cuotas de la OEA. Como es del conocimiento de la membresía, en cumplimiento de la resolución AG/Res 1 sobre el programa presupuesto 2025 de la OEA, los Estados miembros se encuentran realizando un proceso de revisión de la escala de cuotas aplicable para los próximos 3 años. En este contexto, se realizan consultas con las instancias nacionales responsables del seguimiento en esta materia de contribuciones a los organismos internacionales. México reitera la importancia de contar con un esquema de financiamiento equitativo, diferenciado, justo y sostenible para la OPS como pilar fundamental para garantizar la estabilidad de sus programas, fortalecer su capacidad de respuesta ante los desafíos en salud pública en nuestra región y contribuir de manera efectiva a la mejora del bienestar de nuestros pueblos. Gracias, Presidenta.
Muchas gracias, México. Chile, por favor.
Muchas gracias, señora presidenta. Nuestra delegación desea agradecer, por supuesto, la presentación realizada sobre la escala de cuotas y queríamos aprovechar de consultar, dado que estamos en la OEA, en medio de las discusiones que esperamos terminen con la deliberación de la escala de cuotas, en relación al procedimiento que se actuaría en caso de que no llegara a septiembre la decisión. Y en el caso en que la decisión se tomara un mes después, por ejemplo. Si eso afecta la decisión final, considerando que va a tener un costo o un efecto en el periodo de 2 años. Si eventualmente, aunque fuera en el mismo año calendario la decisión, tiene un efecto, ¿qué efecto financiero real ustedes pueden prever que se dilate la decisión por parte de la Organización de Estados Americanos? Muchas gracias.
Gracias, Chile. República Dominicana.
Muchas gracias, señora presidenta, y muchas gracias por el informe que nos han brindado sobre la escala de cuota. Solo quizá una pregunta sobre el procedimiento, porque la escala de cuota en la OEA se calcula para 3 años y veo que aquí dice escala de cuota para 1 año. ¿Qué sucede entonces en los próximos 2 años si es basado en la escala de cuota de la OEA? Muchas gracias.
Gracias. ¿Algún otro comentario? Si no, pasaríamos, por favor, a la respuesta.
Muchas gracias a las delegaciones de México, Chile y Dominicana por sus preguntas. Sí, esperamos de que se concluya. Sería lo más práctico para que podamos tener el documento actualizado con esa escala que los Estados miembros decidirían. ¿Qué impacto tiene? Sería una extensión de la escala actual, o sea, seguiríamos con el pago que hacen a la OPS con las cantidades que están aprobadas con la escala. Es una extensión hasta el momento que se apruebe la escala de la OEA. Volveríamos a cuerpos directivos de OPS para presentarles la aplicación de esa nueva escala, cuando ya se tenga la escala de la OEA. Si es 1 año, o sea, en el cuerpos directivos del próximo año, tendríamos que volver. Ahora, tenemos tiempo Si en junio es el comité ejecutivo, todavía nos faltan 3 meses para llegar al consejo directivo, que es donde de veras van a adoptar. O sea que para el comité ejecutivo, si no hay, seguiríamos trabajando con un escenario interino y esperando que para agosto ya tuviésemos la decisión y entonces incorporarla con la nueva escala. 3 años versus 2 años. Nosotros trabajamos bienalmente, o sea, cada 2 años que traemos el programa de presupuesto, aplicamos la escala vigente. Si en ese año de desfase se aplica la que está vigente y si hay que actualizarla en el interino, a medio plazo, también de nuevo viene a cuerpos directivos. O sea, siempre cualquier cambio que se dé tiene que venir a cuerpos directivos en el interino. Lo que hacemos es trabajar con la escala que esté vigente, extenderla por los 2 años hasta que haya una nueva escala. Lo hemos hecho en periodos anteriores y se maneja que continúa la escala vigente extendida por 1 año más hasta que se tenga la actualización de la escala de la OEA para el periodo que quede para sincronizar con el programa de presupuesto que es o sea, cada 2 años nosotros venimos a este foro y al Comité Ejecutivo y al Consejo a presentarles la aplicación de la escala al programa de presupuesto de la OPS. El proceso de la OEA lo seguiremos siguiendo de cerca, estamos en contacto, cualquier información también le agradecemos de parte de ustedes, algunas delegaciones también nos proveen con actualizaciones que se aprecian mucho y les agradecemos los delegados que están en la OEA aquí por esta comunicación estrecha que mantenemos para asegurar que nuestros documentos estén alineados con sus deliberaciones y decisiones. Muchas gracias, señora presidenta.
Muchas gracias. Ahora le daré la palabra al doctor Barbosa.
No, muchas gracias, señora presidente. Eu creio que é tema, como foi bem apresentado, que estamos pendentes da decisão da OEA. Sabemos que pode tomar mais tempo que é necessário, porque se passa por todo o processo de negociação política, e como nosso diretor do Departamento de Planificação, Presupuesto e Avaliação mencionou, vamos a incorporar automaticamente, como é parte de nossa Constituição, lo que fue aprobado en la OEA. Gracias.
Muchas gracias. Informa al subcomité que el debate constará en el informe final. Siendo así, pasamos a nuestro siguiente punto, el 3.5. Agentes no estatales que mantienen relaciones oficiales con la Organización Panamericana de la Salud. Señalo a la atención del subcomité el documento SPBA 19.6. Se invita al subcomité a examinar la colaboración con 7 de 8 agentes no estatales en el contexto de su revisión trienal y aplazar la revisión del Instituto de Normas Clínicas y de Laboratorio. Informo al Pleno que este tema se tratará en 2 partes. En la primera, la oficina dará una explicación general del tema. En la segunda, se procederá a una reunión a puerta cerrada con los miembros del subcomité y los Estados miembros participando como observadores para llevar a cabo la revisión. Ahora invito a la señora Mariana Faría Teixeira, directora interna del Departamento de Relaciones Externas, Alianzas y Movilización de Recursos de la Oficina Sanitaria Panamericana, a que presente la primera parte de este tema. Adelante.
Buenos días, muchas gracias, señora presidenta, distinguidos miembros del subcomité, miembros que participan como observadores, director y colegas. Es un privilegio presentar el punto 3.5 de la agenda sobre agentes no estatales en las relaciones oficiales con la OPS. En el 55º Consejo Directivo, los Estados miembros de la OPS adoptaron el marco para la colaboración con agentes no estatales, FENSA, por medio de la resolución CD 55R3 de septiembre de 2016. Mediante esa resolución, los Estados miembros de la OPS reemplazaron específicamente los principios que rigen las relaciones entre la Organización Panamericana de la Salud y las organizaciones no gubernamentales con el FENSA. Las relaciones oficiales se basan en un plan trienal de colaboración con la OPS y formulan el acuerdo conjuntamente el agente no estatal y nuestra organización. El plan trienal debe estructurarse de conformidad con el plan estratégico de la OPS y no puede tener ninguna finalidad primordialmente comercial ni lucrativa. Los agentes no estatales en las relaciones oficiales realizan importantes aportes a la OPS y por ello contribuyen a avances en salud pública en las Américas. Algunas de las actividades realizadas por las entidades sujetas a renovación incluyen contribución al diseño de una hoja de ruta para el desarrollo de capacidades regionales en innovación y fabricación de insumos y materias primas esenciales para la producción farmacéutica. También examen y la validación de los pilares pertinentes del Plan de Seguridad Vial de Río de Janeiro, Brasil, tratando el tema de los datos sobre colisiones y la vigilancia. Empoderamiento a más de 15 organizaciones de la sociedad civil del Caribe para que promocionen políticas destinadas a prevenir la obesidad infantil. Realización de 39 conversatorios y seminarios en línea sobre el rol de los laboratorios clínicos y temas de salud pública y emergencia de salud, con más de 6.000 participantes. Durante este periodo de informe, la Secretaría ha trabajado para la racionalización del documento, alineándose con la iniciativa OPS Adelante, que mencionó el director en su apertura, y con nuestro compromiso de mejorar la eficiencia. Este trabajo continuará para automatizar y optimizar el proceso, garantizando mayor agilidad. No se ha recibido ninguna solicitud de ingreso que cumpla con los criterios de ingreso a relaciones oficiales en ese periodo. Si bien el promedio anual oscila entre 1 y 2 solicitudes al año, el año anterior se había recibido el número récord de 7 nuevas solicitudes de ingreso. Durante ese mismo periodo, el subcomité tiene programado revisar 8 colaboraciones existentes con agentes no estatales en relaciones oficiales con la OPS, todas ellas sujetas a su revisión trienal. Se recomienda continuar las relaciones oficiales con la OPS con las siguientes 7 organizaciones: Asociación Latinoamericana de Industrias Farmacéuticas, Centro ROS para Ciudades Sostenibles del Instituto de Recursos Mundiales, Coalición Caribe Saludable, Confederación Latinoamericana de Bioquímica Clínica, Fundación Interamericana del Corazón, Fundación Mundo Sano y Sociedad Interamericana de Cardiología. La Secretaría recomienda aplazar la revisión del Instituto de Normas Clínicas y de Laboratorio, CLSI por su sigla en inglés, para que disponga de tiempo para elaborar un plan más robusto de colaboración. La Secretaría no recomienda interrumpir ninguna revisión. El año pasado, el subcomité aprobó la revisión de 9 colaboraciones existentes sujetas a su revisión trienal. En el caso de la Fundación Interamericana del Corazón, se decidió aplazar su revisión para que se dispusiera de tiempo para elaborar un plan más robusto de colaboración. Muchas gracias, señora presidenta.
Gracias. Se procederá ahora a la reunión a puerta cerrada. Invito a los miembros del subcomité, al asesor jurídico, a la señora Faría Teixeira y a los responsables técnicos de la oficina a cargo de la relación oficial con los agentes no estatales a que permanezcan en esta sala. Asimismo, deseo invitar a los Estados miembros que participan en calidad de observadores a permanecer en la sala si así lo desean. El resto de los participantes los invitamos a que tomen un receso y los invitamos a reincorporarse a la reunión en unos 15 minutos. Muy bien, entonces retomaríamos esta parte de la sesión a puertas cerradas. Procederemos con el examen trienal de los agentes no estatales que mantienen relaciones oficiales con la OPS. La oficina examinará 7 de los 8 agentes no estatales en el marco de su revisión trienal. La revisión del instituto A continuación, revisaremos la Asociación Latinoamericana de Industrias Farmacéuticas. ¿Hubiera alguna pregunta o comentario? De no ser el caso, la oficina procederá de acuerdo con la recomendación de mantener las relaciones oficiales con este agente no estatal. Continuamos con la Confederación Latinoamericana de Bioquímica Clínica. ¿Alguna pregunta o comentario?